Just when it seemed the coast was close to clear, the pandemic roars back to dangerous life in Michigan. Our fair peninsulas are now the nation's preeminent hotspot. What is happening? And is it time to shut it all down again? Today is Sunday, April 11th, 2021, and this is Flashpoint. Hi there, and welcome to Flashpoint. Good to have you here. What happened? That question will permeate today's program. How did Michigan suddenly go from the model case study on the nation's COVID map to blazing red in such a short period of time? Last week, the U.S. was averaging about 65,000 cases of coronavirus a day. Pretty jarring when you realize around 8,000 of them were from Michigan alone. Last year, as the pandemic was really starting to get its legs, we talked on the program about the natural progression of a virus, that it gets less deadly but more contagious. And that's what's happened as the variants have strengthened the potency of this thing. But the idea of less deadly is cold comfort if you're in a hospital right now, suddenly running out of space, watching doctors and nurses who are exhausted yet again. And now it's to the point that some hospitals are putting a hold on elective or reschedulable procedures. The good news is, as we see fewer seniors coming down with the virus, it means the vaccines are doing exactly what they're supposed to. But with younger people now making up the bulk of the cases and the positivity rates rocketing, it means Michigan's testing and vaccine efforts need to hit the accelerator, and quickly. Governor Whitmer heard a ton of criticism for not opening the economy sooner. Now she's hearing criticism even from the CDC for not shutting it back down. She responded Friday by begging for more vaccine, though she urged Michiganders to take a few voluntary steps too. How do we best respond? It's all today on Flashpoint. Our singular focus today is coronavirus, so I can't think of a better place to start than with Dr. Arnold Monto, epidemiologist at the University of Michigan and the leader of the FDA Vaccine Committee. Good to have you back on the program again, Doctor. I want to start with a question that is vexing a lot of people right now, and there's a couple of different explanations making the rounds, but I really want to hear yours. What are we watching happen in Michigan? Why have we seen a jump that is so out of step with our neighbors?
Well, I think the explanation is complicated. There's no single factor. One of them is, yes, we are seeing more of the variant. Yeah. The whole country is seeing more of the variant. We had an introduction of the variant back in January. We seem to control it, but you can't stop something like that when it's taking over and has what we call a competitive advantage over the other virus because it spreads more easily. So that is happening, and that variant is more difficult to control. Fortunately, it's covered completely by the vaccine. But another thing that may be a factor is that we did such a good job early. We didn't see a lot of the infections which produce immunity and therefore will not occur. You won't see as many cases afterwards. And we're sort of catching up simply because people are getting tired of following the rules. They're doing things that they shouldn't be doing. And we're catching up because we weren't there before.
We did, I think you'd have to argue, we did a pretty good job of mitigation early, but weren't we one of the hardest hit states early on?
Well, it depended where, because it was the Detroit area, some other areas. Actually, things were up and down. It's been a long time, and that's part of the problem. It's been over a year.
And this may take years for us to fully understand. We look at other states that took far fewer efforts at shutting down their economies, shutting down businesses, mask regulations, on and on and on. We look at the numbers between Michigan and Florida. Florida had more cases. They've got higher population. Per capita, we kind of seem sort of the same. Can we compare whether or not yet, do you think, to your mind, can we know yet whether or not mitigation efforts have helped much, or that this virus had its own plans no matter what we did?
Well, again, it's a bit of both. The virus is unpredictable. We know that there are clusters of infection. And we also know that places like Florida were not monitoring things as closely as we were as well.
Yeah.
And so trying to look at numbers other than the hospitalizations and deaths, because you can't argue about those numbers,
Right.
is pretty hard.
Yeah. As we look now at what's happening with the vaccine, we're starting to understand that we're going to reach that moment where right now, I suppose you'd have to argue that we're still at the point where demand outstrips supply. But we're going to reach that moment, people fear, experts like yourself, where maybe the demand starts to slip behind supply and we won't yet have reached that magic number of 70% or 65%, whatever it is that you feel that would reach herd immunity. Are we going to have enough people, to your mind, who want the vaccine and are willing to take it?
Well, I think we may be doing better in Michigan. We've also had already had reports of people crossing the border into Ohio to get vaccine because it was available there and not here. And I think to a large extent, it's because the demand was higher here. I think we're doing much better than other states. I saw reports of some of the southern states. The report came from Mississippi, where the vaccines are now sitting in the freezer. They're not being administered. But we have to keep working on it. We have to keep convincing our friends and neighbors that it's safe, that we've all got it, and the results are in the fall in hospitalizations and death rates in older individuals who have been fairly well vaccinated.
We look at polls and we see that of the people who don't want the vaccine, twice as many of them are Republicans as Democrats. So this political sort of injection still remains. And I have to believe that you find that deeply sad.
It's deeply sad and a little bit strange because some of the people who are Republicans are also highly religious people and want to do good to their neighbors. And you can't do a better deed for your neighbor than to do something which will protect yourself and the community.
It's interesting you say that because I lament that all the time. I think that's one area where people like me just have not been able to break through with the message that whether you're wearing a mask or getting the vaccine, people want to see that as a matter of individual choice and liberty. But what you're really doing is taking care of somebody else as much as yourself, if not more.
Well, I think back to the arguments about seatbelts. People forget how long it took us to adopt a seatbelt mandate because, it's an individual choice.
I have to believe that you are very frustrated with continually trying to put out fires of the conspiracy theories and the worries that people have, chief among them that this is such a new vaccine because, as you've pointed out on the program before, this was actually the result of many more years of work than most people appreciate.
Right, and the only thing that is quicker here was because, fortunately, the previous administration, and this should be a message to those who were supporters of the previous administration, they put a lot of money and effort into vaccine development.
Yeah.
We wouldn't have the vaccines now if we hadn't had a lot of extra effort and organization put into the development of vaccine. And that's another reason I find it so paradoxical to see the split in the population about uptake.
Boy, it sure is. Dr. Monto, it is really great to have you back on the program. I so appreciate your thoughts and your time. Stay safe, and we'll talk to you again soon.
Thank you very much. Bye.
You bet. So long. Dr. Arnold Monto from the University of Michigan. We come back, we'll talk about the load that is being placed right now on our area hospitals. This is Flashpoint on Local 4.
For 81 years, we've been here for Michigan. From day one to year 100. Committed to the communities we call home. Because we're here for it all and always will be. Confidence comes with every card. We're here for you. With resources that make connecting with your coverage and getting the care you need easier than ever before. We're here for it all and always will be. Confidence comes with every card.
Hi, I'm David Hall, and now is the time to refinance your home loan. Take years off your loan, lower your payment, consolidate some debt. Hall Financial's ready to help you achieve your goals. Don't miss out on historically low rates. Go to davidhallmortgage.com.
Hang on. It's a $100 million sale and clearance at Gardner-White. We are overstocked and we need to make room. Everything discounted, price cut, and marked down. Sunday, take an extra 20% off the lowest price. Plus, save even more because we will pay your tax. Or get 0% financing for 60 months and no down payment. That's savings up to 70% off with free same-day delivery. This is why we are Detroit's #1 furniture store. The $100 million sale and clearance only at Gardner-White, Sunday 11 to 8.
When weather attacks, will your roof fail to protect you? Why worry when there's a simple solution? American Standard Roofing, a GAF Master Elite Contractor. American Standard Roofing, roofing made simple.
You know, there's usually not a great time to need to go to the hospital, maybe aside from getting ready for the delivery of a child, perhaps. And even that right now might be a little fraught with worry over the virus taking up residence in seemingly every corner of the hospital. Good to have Bob Riney back with us again. He's the President and Chief Operating Officer for Henry Ford Health Systems. Bob, for starters here, kind of describe the level of stress that your system right now is being put under.
Well, good morning, and I'm really happy to be here because I would define our staff as being resilient, but really exhausted. As you can imagine, this has been a year-long battle, and I think what makes this current surge very difficult is we started to see light at the end of the tunnel, and we started to be able to schedule some of our caregivers for some desperately needed time off, and then this surge hit us again. So it's really disheartening for the team. Having said that, they wake up every day and go in and give it their all.
I really had thought that you and I had our last conversation about this kind of situation in the state's hospitals, and yet here we are again. Did you think that we were maybe on tap for yet another surge, or are you as surprised as many others have been at what's happened in Michigan?
You know, we were very optimistic that the trend lines were all going in our favor, and we were worried about two things. One is the new variants that were emerging, and second, whether people would let down the discipline of behavior that had really helped us. And unfortunately, we saw the variants come in a big way, particularly the UK variant, and then we saw a letdown of some of those disciplines that had really helped us for so long. And so, here we are as it relates to those two things intersecting.
The governor, of course, on Friday really made a plea for some voluntary help from Michiganders, not really stringent shutdowns that we saw in the past. As the head of one of the state's biggest health systems, is that the right approach, or would you rather see us locked down again?
We're supportive of any effort that will help us ease the stress that we have right now. And, policies only get you so far, especially when they cover such a wide range of area. And so we're really hoping, and we do partner with the governor on asking Michiganders to do the right thing. And quite frankly, to think about the healthcare workers. They have been there for you each and every step of the way, not just for COVID, but for all of your other health needs. And they are going to be there in the future for all of us, but they're tired. And the best thing we can do is really support their need to get a break.
We, part of the, in fact, Dr. Monto, before you, one of the things that people are pointing out is that the fact that fewer seniors are the ones showing up in the hospitals right now, and they're the ones who are getting the vaccine, is proof that this vaccine works. Tell me a little bit about the patients who are showing up at the hospital now compared to months ago.
And this is a good news story. I mean, it's not good news that anyone is ill with COVID, but the average age of the over 500 COVID positive patients that we have in our hospitals as of today is almost 12 years younger than it was during the first surge last spring. And that is one simple reason: vaccinations. And so we are proving that vaccinations work. And so we are urging everyone to get your shot in the arm. It is really the way we're going to get back to normalcy. And quite frankly, it's frustrating when I talk to people who are really so frustrated that they can't get back to normal behavior, and yet they say, well, no, I haven't gotten my vaccine. I'm still thinking about it. We've got to get shots in the arm, and then we'll all get back to the life that we have come to really enjoy and miss.
Well, I wouldn't want to ask you to put out every little fire that pops up on social media, but one of the sort of threads that makes the rounds is, look, there's a whole bunch of healthcare workers who don't want the vaccine, and these are the people who know. Can you talk a little bit about vaccine participation among your staff and doctors and nurses?
Sure. We have the majority of our team members are vaccinated. And when you get to physicians, you're in the 90+% vaccinated. So I don't think it's about any kind of inside knowledge. I think healthcare reflects the general population, and that we do have people that have hesitancies or that somehow believe because they had COVID already that they've got some antibodies and they can wait for a while. And I think this is a time where all of us have to just do something pretty simple, and that's trust science. I mean, it is working on our behalf. I would ask all of us to think about the state we would be in right now if these vaccines hadn't been created. And so I think that should be motivation for everyone. You know, there's always going to be hesitancies, but this is our path to independence again.
And especially given light of the new variants that are making the rounds right now and what you're talking about, one of the things that worries me is when I read that a number of hospitals are really being pushed to the brink in their intensive care units. That's with a year's worth now of knowledge over how to treat these patients. That says a lot, doesn't it?
It does. And, you know, as I mentioned, the patient population is younger, but please don't misunderstand. They are still very sick. We have improved dramatically the mortality rate. Far less people are dying because of the advancements in care. But these individuals are still very sick. And we also know that a percentage of them will go home and have lingering effects from COVID for months and months to come. So this is not something that any of us want to do anything but rally around putting it in its compartment, in its place.
The so-called long haulers, we keep hearing awful stories about their experiences. Lastly, I want to ask you the same question I asked Dr. Monto, and that is whether you're worried about our ability to reach sort of that herd immunity level, given the number. Sooner or later here, we're going to arrive at maybe we've got more supply than demand for the vaccine. At least that's the way it seems when we start looking into polls and who's willing and who's not willing to get the shot.
Well, you know, I'm going to remain optimistic, and I'll tell you what, I pull up to our corporate office where my office is, 1 Ford Place, every day, and we're a mass vaccination site. We have turned our whole first floor, and I see lines of people every day for this vaccine. And I really believe as we continue this conversation and we appeal to people's common sense and common good and support of each other, Michiganders are going to come through. We're going to get these vaccine rates where we need them to be.
Let's hope so. We're going to talk about that in our next segment as we start to zoom in here on Detroit. In the meantime, Bob Riney, Henry Ford Health Systems, thanks so much for the time, and stay well.
Thank you, Devin.
You bet. Back with more. Denise Fair joins us next on Flashpoint.
Go big on baseball this season, because DraftKings Sportsbook's latest offer is a real hit, literally. Bet $1 on your team, win $100 if they get a hit. It's that simple. One hit, $100. All you have to do is download the DraftKings Sportsbook app, sign up with the promo code, bet $1 to win $100 if your team gets a hit, and make it rain.
Sometimes you want a bigger mattress. Right now at Gardner-White, get a free king upgrade. Pay for a queen and sleep on a king. Save $300 to $800 on our huge selection of premium mattresses. Plus free power base, free TV, and free same-day delivery. Like Serta Perfect Sleeper with a free power base, just $655. This is why we are Detroit's #1 mattress store. The $100 million sale and clearance at Gardner-White.
This is not just a mask. It's a bridge to better days. The path back to togetherness and protection for those we love. So until we all get the COVID-19 vaccine and build community immunity, which will take time. Stay careful, mask up, and social distance. Spread hope, not COVID.
Around here, the weather can turn in a snap. I've got you covered in the afternoons and at night, but the moment you wake up, you've got the most experienced morning weather team in Detroit on Local 4 News Today. While you're sleeping, local forecasters Brandon and Paul are using Storm Tracker 4 to answer two vital questions. What happened last night?
Yesterday, gusty southwest winds.
And what's going to happen today?
Storms are on the way, so don't forget to pack your umbrella.
No matter what time it is, we've got you covered on Local 4 and click on Detroit.
Welcome back. If you've gotten your vaccine at TCF Center in downtown Detroit, as I did, then you know that it is an amazingly well-run and efficient operation, really a thing of logistical beauty. But the truth is, not enough Detroiters are availing themselves of that opportunity. Detroit is lagging the rest of the state in vaccine participation. Let's talk about that with the city's chief health officer, Denise Fair, back with us again on Flashpoint. Denise, let's start with that. Why do you suppose right now Detroit, obviously much bigger population to try and handle than when we compare it to the other municipalities around the state, but why do you suppose Detroit's a little behind right now?
Yeah, you're absolutely right. We are lagging behind. We have so much more that we need to do in the city of Detroit. And it's not a question of access. There are multiple ways Detroiters can get vaccinated. They can go to the TCF Center. They can go to our community Saturday sites. They can go to any one of our pop-ups. But now we have to work up here. And that is changing the mindset. At the health department, our job is to educate people. We want to empower them so that they can make an informed decision on whether they should take the vaccine. And I'm here to say, take it. It's safe. It's effective. It's going to save your life. And that's what our message is.
The mayor's office has been talking about maybe the need to go door to door. That would seem to be an overwhelming task, but is that where we are?
It's an overwhelming task, but it's the right thing to do. In fact, I will be out there as well with Vicki Kavari and her team. We are going to knock on doors, especially in those areas that have a high SVI. That's the Social Vulnerability Index. But we want to meet people where they are, whether they're tuning in on a press conference or on a Facebook Live, or whether they are right at home. We want to knock on their door, give them education, and tell them where to get the vaccine and why to get it.
You no doubt have heard some of the upset from especially other counties. We've talked about Livingston County feels like they really didn't get their fair share of the vaccine so far. Have we done this the right way in the way that we've tried to distribute the vaccine, or are we learning lessons for the next time?
We're always learning lessons, and I hope we don't have another pandemic, but we have learned from the height of the pandemic a year ago. We know what works well, and what works in the city is getting the word out, having our trusted leaders share the message about getting the vaccine. You know, we work really closely with our clergy. We've encouraged them to get vaccinated. We've encouraged them to tell their members about getting the vaccine, and that has worked really well in the city. You know, in the last couple of months, we have seen a rise in hospitalizations and cases and our percent positivity. And frankly, we are right back where we were a year ago. I am incredibly concerned about where we are heading, but we need to double down. I mean, we know what to do. Now we just have to do it. We are experiencing pandemic fatigue. We're tired of wearing our masks. We're tired of washing our hands. We're tired of not, spending time with our loved ones in the way that we know best. But that's what we need to do right now to get back to some sense of normalcy. But it starts with getting the vaccine. You know,
Denise, Detroit was hit so hard so early. We watched all the efforts at fixing that, and Detroit really turned the ship. Now, with this new surge, we've even got the CDC peering into Michigan saying, look, you need to shut down again. The governor has kind of resisted doing it in an official way. Would you like to see us return to the sort of ordered shutdowns that we saw during the first surges?
Look, I appreciate what our governor has done for the state of Michigan, for the city of Detroit specifically. She has been looking at data and science, and that is what has been driving her decision making. And as we all know, she is encouraging everyone to not only double down on the safety precautions, but to be mindful. And instead of going inside to a restaurant, be really careful and think about takeout instead. She's encouraged all the schools to extend their spring break a little bit longer so that we can control this virus. right now the virus is winning. And the only way for us to fight back is to make sure that we are following those safety precautions. We are limiting all of our interactions so that we can get back to normal.
Let me let you weigh in on sort of a theme that we've developed through the program this morning, and that is whether or not we're going to be able to get enough people to get the vaccine in Michigan, in particular in Detroit, for us to reach that sort of 70% threshold that we've been told is what's required to create herd immunity. We're way behind that at the moment. Can we get there?
Yes, we can absolutely get there. I know in the city of Detroit, we're right around 23%. And because, I'm looking at the young people now. So the governor has opened up the floodgates. So now anyone over the age of 16 years old can get vaccinated. So I'm looking at Generation Z. I'm looking at the millennials. If you're on the fence about getting the vaccine, this is your time to shine. This is your time to step up and make a difference in the city of Detroit. And so if we do that, we will get to community immunity, and I hope that'll be sooner than later.
Who have you found is tougher to make the case to, the older folks or the younger folks?
It's my generation, those who are under 40 years old. We are literally on the fence thinking about whether we should get it or not. I've spoken to some of my friends who are they're waiting and they're seeing they're healthy. They don't have any comorbidities.
Right.
But I've told them time and time again, and I know I'm the Debbie Downer in our friendship group, but they have to get vaccinated because they could end up in the hospital, and I don't want to lose them. So that is our message over and over again. Take the shot, get it over with. Let's get safe. Let's get back to business.
Denise Fair, you got a massive job ahead of you. Thanks so much for the update and the time. We'll talk to you again soon. Stay safe.
Thank you for having me.
You bet. That's going to do it for Flashpoint. Thank you so much for being here today. Meet the Press coming up next. Have a great week. We'll see you next time on Flashpoint.